Sir, if basically a burn happen, a patient suffer with burn injury. So, what condition? At what condition patient should immediately go for a medical observation or medical treatment?
Any burn which has a large area or any burns on a specific region, like burns on the face, burns near the eyes, nose or ears, and burns over the genital region,
Okay.
and large area of burns, these burns should be immediately contacted. And any burns of children, very small children and very elderly age group, these people they need a special care for burns, so immediately medical intervention should be sought in them.
Okay.
And any special type of burns like chemical burns, like radiation burns, or any burns because of the electric burns, these burns definitely they should be immediately contacted. They should be immediately seek medical care.
Just now you two discuss about thermal burn, chemical burn, and I think electrical burn also come as talk as thermal injury.
No, electrical burn is different.
Different.
But it is also dealt by
So what's the difference between chemical burn and thermal burn? How it differs?
chemical burn is like, see, chemical burn it may be an acid or it may be an alkali. So both causes different types of burn. What acid does is it will coagulate the skin. So initial superficial layers of it get coagulated. Then this coagulum helps the further acid. It should not go inside. So it will not go inside. This coagulum will stop as a barrier.
Okay.
So it does not cause any deep injury. But in vice versa, alkali does not cause any coagulum. It directly penetrates deeper into the skin.
Okay.
So in a broad perspective, alkali causes more deeper and more damage than the acid.
And that's it.
Yes.
And what about the thermal injury?
Thermal injury is a normal flame burn. Because of heat, the superficial layers of skin are damaged. And the electric burn is completely different. Electric burn is usually very less. And if electric burn it happens, it can cause injury to the skin, it can cause injury to the fat, muscle, bone.
Okay.
Sometimes it can damage, and the bone also can die because of the current, depending on how high voltage current the patient has caught the fire with.
Okay.
So that is it.
So I think first, if I'll grade it in such a manner that first one will be the electrical burn, then chemical burn, then thermal burn.
Thermal burn. And every time that's not the scenario. Every burn, the severity of burn is usually depending on how percentage the burn has happened. The percentage usually we calculate about the surface area of the body. Imagine a patient is there or any person is there, he is 100%. So how much percent of his skin is burnt? That brings the severity of the burn. It may be chemical, it may be electric. Electric 5% burn may be there, but it may be too deep. And thermal burn, if it's 10%, okay, it is fine, it can be salvageable. But if it is 50-60%, then it is more severe.
Okay.
So the severity is more based on the percentage of the burn, more than the type of the burn.
Yes.